So Revati, what you want to become actually? Any idea? Any plans for you?
I'm doctor.
Very good. So which part of a doctor you want to become an?
Not planned, ma'am.
Hmm.
But first I should pass in NEET. After I can plan it, ma'am.
Of course you will pass. Why you have a doubt in passing that?
No, ma'am. But first, if I finish NEET exam, I can decide. No, ma'am.
Yeah. But before NEET itself, you can decide which doctor you want to go for also.
I'll finish first, second PU, ma'am.
Then only you'll decide.
Because still not decided, ma'am. First I
Okay.
should see my studies.
Okay. So so we have like an medical career path. So you have so many different types of doctors, right? We have
Yes, ma'am.
many doctors for hair, skin, eyes, nose, throat, ears, teeth, everything. So there are so many parts. So Revati, what you want to become actually? Any idea? Any plan? Come to an entrance exam, that is a 12th examination. Okay. So in 12th examination, you have to clear all the subjects, including science. We have to get a very good marks in science, physics, and chemistry. So the NEET is always based upon physics, chemistry, and biology. Okay. So in these three, you have to be on the studies also. All the textbooks you have to be refer. You have to always refer your textbooks. You will be having lot of guides, study materials, everything. Even though you have a lot of materials to go through, but you have to always have a backup of a textbook. Okay. And during for entrance exam preparation, there will be a like very tough time. I know the students will be going through a very, I mean, the students has to pass on the NEET exam. Okay, so in NEET, there are only one attempt of NEET examination. And for engineering, you have two attempts. For NEET, you have only one attempt. Okay, so you have to be thorough in all the subjects, each and every point of your textbooks. If you're thorough with each line and everything in the textbooks, you are good to go with it. Okay, and admissions procedures will be like in counseling only. So don't give up in first counseling. You should be always with the uh, 2-3 sessions of counseling. Then immediately you will get it. So preferably not only the MBBS, we have so many departments of doctor fields. Okay, you people might know that only MBBS only is a career, and not only the MBBS. You have ENT, skin, air, everything. But MBBS is the base for the other departments. So once you clear with the MBBS, then you can go for a specialization like for MD, MS, and for special for pedo, and so many are there: neurologist, nephrologist, cardiologist, and for dentist you need only BDS. And after BDS, you can go ahead with MDS. That is the only 2 degrees for BDS and MDS. Okay.
Okay, ma'am.
Then any doubts you have, any clarification you want to go with it. And apart from the doctors and everything, we have so many other fields also, like nurse, because nurse plays a very important role in the doctor's family. So beside the doctor, the nurses comes the next place. So nurses also plays a very, very, very important role in the doctor family. and we can have lab technicians, ultrasound, so many are there. And you can become a chemist, pharmacist, and so many on there. So the only thing, the basic is 12th and NEET exam. So some of the departments, no need for the NEET exam also. But I'll go through it in the next session, where you need a NEET, where you don't need a NEET examinations and everything. Then you can become a physiotherapist, dietitian, nutrition, everything. Everything follows within doctor's family only.
Anna.
Anna. Anna, which class are you in?
I finished 10th. I'm going to 11th.
Oh, good. So which you have taken? PCMB or PC? Huh?
PCMB.
PCMB. Okay, very nice.
Good afternoon, ma'am.
Yeah, hi, Shruti.
Yes, ma'am. I'm Shruti.
Hi, Shruti. Which class are you in?
Ma'am, I am studying in graduation from BCA. I am joining the webinar on the behalf of Matrigal so that I can deliver your messages to some of the children who did not join it.
Sure, sure. Thank you so much for doing that. So please ask me any questions, any doubts you have.
So explain them how a day in the life of a doctor will be so that they'll actually know the real picture of who the doctor is.
Yeah. See, first of all, I should introduce myself. I'm Dr. Jaya and I'm a dentist. Okay, so in day-to-day life, doctor is very important in our life actually. Right? Yes or no?
Yes, ma'am.
Yes, ma'am.
Yeah. So in what way doctor is very important for you? Guys, please answer up.
For helping others.
Yeah. So we all know that doctor is very important in our life. Correct. So to become a doctor, you should do a very, 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 very hard work in your +1, +2. Correct. So if you clear +1, +2, then you can attend NEET exam. Correct. Yeah, please.
Is NEET exam difficult or easy, or is it medium? Can everyone pass?
Everyone can pass NEET.
Okay.
Only thing, your hard work should be there.
Okay.
Without hard work, nothing is possible.
Okay.
As I told you, you should always refer many books. See, when you are okay with so many question papers, when you are attending so many question papers after 12th standard, you will be giving training for NEET exams. So you will be having so many sessions for your NEET exam training. They will be providing lot of question papers to attend it. So when you keep on writing the question papers every day, at least 5 to 6 papers a day, it will be like a hands-on for you. It will be very easy for you to write your NEET exam.
Okay.
Got it? So
Yes,
it's
ma'am.
easy when you're okay with all your syllabus.
Okay.
Okay, ma'am.
Then any other doubts, please ask me. See, 10th and 12th standard. So if you can, I mean, in some people who cannot go with the other for higher studies or something, they can always go for a diploma in PCB and health inspectors. It's like that, medical field, lab tech, lab technician people. So many are there after 10th also. In after 12th also, there are so many odd things. There are so many government jobs also is available actually. But everything is depend upon once if you're going for a MBBS or a for a BDS or something, NEET is important.
Dr. Jaya, Sheetal here. I have a question for you.
Yeah,
I think
please.
the students would love to know about, as we talked about, that what are the key skills a doctor need to have. When I say skills, maybe how do they manage their day, once they become a doctor, and how has been the journey once you get selected after NEET. So if you can kind of help them go through that,
Yeah, sure.
this will start giving them a lot of ideas of how maybe
Yeah,
motivate
yeah.
and inspire them.
See, I can tell about myself first. I start my day at 5 o'clock. When I passed my 12th standard, I used to before 12th itself, I used to get up at 5 o'clock or 4 o'clock. That in the early hours. When you start studying in the early hours, it will be very calm, peaceful. You can make your mind. The concentration levels will be very high that time. Then you study till 9 o'clock. Have a break at 9 to 11 o'clock. Have a have study at till 2 o'clock. Have your lunch. Have a nap. Again, continuously you can study till 9 o'clock. 10 o'clock, please wind up and sleep. This is my routine, and I always tell my kids to follow my routine. My son is doing in 12th standard right now. So as I'm telling to my son, I'm telling to you guys also the same thing. You have to work very hard, question papers. Got it?
Dr.
Yes,
Jay, one
ma'am.
more question. Do they really need to join these coaching center which are like mushrooming all around, or is it that if they do the NCRT books thoroughly and if they buy a few, MCQ papers books, and that is they just have to be thorough in preparing, and that will be good enough. Please
As
advise.
I told you in the first thing only, NCRT books are the very important. It's like what we say. It's like if you follow up each and every line of your NCRT books are quite enough. And you will get online question papers also that you can download and write daily the answers. That's it. The only thing you have to study, 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 and keep on writing your question papers. Keep on solving your question papers. So physics and chemistry, you will be like this. You have to attend because so many questions will be there in physics and chemistry. Biology to okay because that will be a one answer. But in physics and chemistry, there will be a lot of the similar questions will be there. You have to understand. To understand that itself, you will have lot of you should have a lot of time. Keep on thinking means you will waste your time. There is only 3 hours for your examination for NEET. Okay, in that 3 hours, it will be like one hour you should spend. So when you thorough with lot of question papers, that will be easy for you to go through the examinations. And you won't feel like nervousness or you what is this question happening? I have never seen that question. So you should not think in that time. So thorough with your NCRT books. Each and every para, each and every line is very, very, very important. You might join in any coaching centers also, but it's not required. Yourself, this thing is quite enough.
Okay, ma'am.
Any other questions, please?
Any questions? If you want, you can type in or unmute and ask. As the doctor is here, you can directly get the answers from her.
I have one question. Is it an MCQ, multiple choice questions, or is it a detailed question answer?
No, it's MCQs question papers.
Yeah, but the choices are so kind of confusing that you have to be very, very
Yes.
thoroughly prepared.
Yes. Yes. The questions will be very similar. The answers will be very close to each other. Only a number of numbers will be like differing. So it will be like very confusing. So in that time, the examination, you should not feel nervous or anything, but you should be confident in picking up the answer very quickly. Some concepts will be there in 12th standard or anything. That concept, if you keep on having a thorough of it, it will be very, very, very easy for you. Everyone can clear your NEET exams.
Dr. Jaya, what will be the criteria child should, kind of a student should think through to decide whether they should become a doctor or not? What could be those pointers that they should ask, which can clearly define that, yeah, this is something which I should go for? Right now, what happens is that because of peer pressure, parental pressure, even the society pressure, as in we know that doctors, this is a very easy career, everybody knows about it. So they think that let me go for it. But how will you guide these students to know about themselves and their personality? And okay, yeah, this is the kind of career you should go for.
See that if you ask me, I have a childhood this thing that I should become a doctor only a doctor. But I have not decided what type of doctor I'll become. If anyone ask me in my childhood or in my till 10th standard, I have not decided. I'll only tell I want to become a doctor. That should be there, first of all. That you should serve to the people. And that, what to tell, that it should be there from your childhood only, first of all. And after that also, see, depends upon, some people will become a dentist, some people become a physiotherapist, some people become a MBBS, and after that they want to become a surgeon also. Surgeon and go on further studies will be going on. The study doesn't have any end actually. And I chose to become a dentist, and I have become a dentist. So while 11th standard, I have decided to become a dentist, not MBBS. And also, if you come to a payment part on anything, the doctor's pay will be less comparatively, but you will have a lot of respect in your society. That respect only feels you very good. So you should be mentally prepared that you should become a doctor, you should serve to your people, and for less money, for free of cost. So everything you should be prepared in mind. Not that after becoming doctors, I will earn so many lakhs of lakhs. No. So you can earn, not that you cannot earn, you can always earn lakhs of lakhs money. So that's all becomes from your development only.
Okay, there is a question from Shruti, and I'll just read it for you. Ma'am, due to some reason, there's fluctuation in study routine. Then how can we achieve consistency again? So I think they need some tips, and because we know that it's a tough exam to crack. I think few tips, as you said, that wake up early in the morning. That's the best time. But few tips to keep themselves motivated, inspired, and whenever they are not able to follow the routine, how to bring themselves back into that routine thing. So please advise something.
Yeah. See, one thing, we should have a self-confidence in us. Self-confidence we should never lose. Not that you're studying, you should not help at home or anything. You should be helping at home. Keep your mind free. The only thing, see, nobody can motivate you anything. You become your self-motivation. Self-motivation is a very important thing rather than people coming and motivating you. Why is that happening? Why can't you motivate yourself? Correct? So we can motivate ourselves. Yes, I can do it. I can crack this exam. Yes, I can do this. I can finish off this portion in this time. I can do this. I can finish off this. So each and everything you should have a self motivation. Nobody is going to be behind you once you succeed. So when you are in failure, once you succeed, everybody will be there behind you. So self motivation is very important. You should have your confidence in you. You should always have prepared mind what I'm going to study for today, what I have to finish off this to this time to this time. So each and everything should be like a time based. You can go out with your friends, you can Yes, Sheetal.
Yeah, so I was saying that based on what you have told us, is more like timetable is a very important thing.
Exactly. Timetable is very important. If you have an exam within a 40 days or 30 days, please sit and make your timetable. Prepare your timetable as such, you will finish off your goals. So you will be within 40 days, you will finish off your first revision, second revision within 20 days. Then after 20 days, you will be start writing your examinations. This is like a self examinations. So you can get lot of question papers outside. You can download it. Online question papers are there. Download it. Everything. Minimum 5 to 6 papers you can write it in a day. So how, because in that 20 days you cannot keep on sitting and reading. The only thing, answering the question papers. Then before one day of exam, don't study anything. Keep calm, sleep, eat, and fresh-mindedly pray and go to exam. That's it. That is what I tell to my son, my kids.
Okay, ma'am.
Ma'am, I have a doubt.
Yeah, please.
Um, uh, uh, as you are a dentist, there are many dental equipments. Whether are they costly or is it affordable price?
See, you can buy it. You can buy it in 50,000. You can, the how the equipment depends upon, that's your call. How you're going to put a setup of your clinic? How you set up in your clinic in a posh area, mid-range. So accordingly, you can place your chair. You will have a chair, dental chair of 1 lakh to 30 lakhs. So this all depends upon how much, where we are going to place a clinic. You can always work in hospitals. You can set up your own clinic. You will be having your own identity. Got it, Anna?
Yes, ma'am. Yes, ma'am.
You will become a dentist like me?
I wanted to.
Yes.
But if I
Good,
know,
Anna.
Anna said that she want to become a pediatrician, right, Anna?
Ma'am, sorry.
I said I remember you said you want to become a pediatrician.
Yes, ma'am. I have choices. Still in choices.
Absolutely.
Yes, yes, you have choices.
Yes, ma'am.
So after NEET, you have to decide in your counseling what you have want to.
Yes, ma'am.
So any other doubts, please, Anna, please ask me.
Ma'am, no doubts.
No
If I
doubts.
have,
Yes. So
So Revati and Shruti, if you have any questions, go ahead and you can ask them now. On a quick note, with you, Dr. Jaya, I was saying, so I think it's very important now. If you look at quite a few students are in PU1 and PU2. Considering that, I think the only thing that they have to do, as you have emphasized quite a bit right now, is that they have to start studying. I know what happens in these cases is that start studying and all, it's look easy, but give a quick tip, in the sense of that, see, this is your 11th course along with your usual studies that are happening in the school, and with the, you have to go and give the exams there, you have to prepare for your NEET exam also. How you divide your time, right now there are holidays, what you should do, and how to make sure that you keep up with the pace. So if you can kind of give them some tips, that will help them a lot.
yes, Shita. See, holidays are only for a peace of mind. But too many holidays, too many vacation will feels you bored, dull. Correct? You
Yes,
enjoy
ma'am.
your holidays. Not that you should not enjoy your holidays. You should eat well in your holidays. But when you're in 11th standard kids, you should all 11th standard is a basic for your 12th standard. Okay, the basic is 11th standard only. So all your time, you should be have a timetable that morning you get up in the early morning, go through your syllabus, then you can take rest in the evening till evening. Again, you start up with 2 hours of session of at least study what you have studied in the morning. Write an exam in the evening. So no one should be like a guiding for you or anything. Did you study? Did you write your exam? No. You should be a teacher for yourself. You should be a monitor for yourself. Nobody is going to monitor you. Whether you're going to write an exam, you're going to study, what you're going to do. It's all you have to make a plan. How you're going to plan a day. So if you're going out, study before 2 hours. Go out, enjoy, chill out with your family. Then when you're back, study for 2 hours. Morning 2 hours, evening 2 hours. Plan your day like that. If you're going in the evening, not able to study, please compete with this. At least 3 hours at a stretch you have to study. 12th going students, please don't waste your time. You have to refer your 11th standard also. Because in NEET, they are going to ask you 11th and 12th. And 12th exams are not so important. In 12th CBSE exams, that is not so important. You can get through it very easily. But you have to concentrate on your NEET exam. The NEET exam is based on 11th and 12th portions. So 11th standard students, please be very keen in your each and everything in your NCRT books. If you have study material, please go through it. So study material have a lot of other questions also. So how the questions will be asked. So there are so many types of questions in one, in a simple question itself, they will be asking 100 types of questions. So you should be always thorough with that type of questions. You should not be surprised after seeing the question paper. I didn't study this. This I have not seen this question at all. No. For that only I'm telling you, every day. Every day 1 hour is your question paper hour. Find out some question papers, find out some 5 years ka question papers, 10 years ka question papers, you find out, download it or take a question papers pattern, start writing what you know first. The same question will be repeating after 2 to 3 years also. The same numbers, the numbers will be like differing. But you should be aware of that question. Got it? But you should study in your holidays. Please don't waste your time. You can draw, you can sleep, you can go out, but you have to plan your day in such a way that you will study for 3 hours. And end of the day, always have a diary or notebook. Then write before sleeping. Have a book. Open your book. Write the day. Write the date. Then you write it what you have done for today. What you have done for yourself for today. Is it okay? Did I achieve for today's goal? Did
Okay,
I
ma'am.
achieve today's anything? So please go through. So after seeing the 1 week diary, you will come to know that what you have achieved or you have not achieved. Then again practice. But make sure one day at least, in a day, in the night, end of the day, you will write your diary. What you have studied, what you have covered up. So next day, what I have to cover. So did I cover that portions which I have to cover last night? So everything should be like you have to be teacher for yourself. Nobody is going to be like a teacher for you anything. Nobody is going to be back of you. Did you study? Did you eat? No, you should be trained for everything. Eat. Time you eat. Okay? Anything?
Okay, ma'am. Ma'am, But after finishing 12th and NEET, we have to take any degree, ma'am?
No, no, no. See, after NEET, you will be having a counseling. So depends upon your marks and everything, the criteria and everything, you will be calling for counseling. So in that, what type of degree you want to go for it, you can go for it. If you're selected for MBBS or not in Bangalore or any other state or something, if you're okay to go, please go. Or if you're
Okay,
not
ma'am.
qualified for MBBS, so many degrees are there. Beyond that, BDS, BPT, so many are there. Got it?
Okay, ma'am.
So, Dr. Jia, sorry for that. Sorry for that. Actually, logging into device, that's the problem. I just wanted to ask you whether, like, so BDS, BPT, everything requires NEET.
Yes.
Last question. We are generally seeing a trend these days where, most of the students feel that, okay, now I have finished my studies and I'm done. And after that, I don't have to. But what I feel is that today is a knowledge economy where you have to keep studying, keep learning, knowing about new things. Is this true even in case of MBBS as a profession where you have to keep learning about what is happening new and how you want to do talk about this important topic also?
See, study, you can study till you're 900 years also. So, so study doesn't have any boundary to stop you. The only thing is in MBBS, yes, you will be knowing because each day you will have one of any of the disease of it will be like arise. So you have to be keep on studying for MBBS, that is for sure. You should be learning each and everything. Every day it will like a new for you. If you see 10 patients, 10 different thing you will come to know. So you will have the MBBS, you have to study. Not that only for MBBS, for any degree you should be studying. You should be updating yourself. You should be knowing what is the drugs, what is drugs in the sense, what is the medicines. Keep on updating. So before though we have so drugs. Now though it is so sophisticated drugs we have. No need for so anything. So so you have to be updated for yourself.